Thank you for contacting iSleep Solutions. We have a crisis going on in America. Sleep disorders, including sleep apnea, have become a significant health issue. Chances are you or someone you know has been struggling with a sleep disorder. I want to congratulate you for taking the opportunity to explore options for treatment. My name is Dr. Pamela West, and my practice focuses on the treatment of sleep-disordered breathing. Sleep apnea is a very serious medical condition that has a dental solution. Most people go through life not realizing that the root cause of their problem stems from an underdeveloped jaw, which can lead to a restricted or even obstructed airway. The development begins as an infant, but then can create a lifetime of medical and dental challenges into adulthood. If left untreated, this can lead to a whole slew of medical ailments that has all been correlated to an obstructed airway. We offer non-surgical, non-pharmaceutical, and even permanent solutions to the treatment of sleep-disordered breathing. In a moment, our sleep coordinator, Melissa, will present a short video on the science behind the development of the jaws. I think you will find it interesting. Please let us know if you have any questions. We look forward to seeing you soon.
Hi, I'm Melissa, and today we're going to talk about sleep apnea and some possible treatments that Dr. West can offer to you. Sleep disordered breathing is a very common problem, and it often goes undiagnosed. So what is sleep apnea? Sleep apnea is when you stop breathing for 10 seconds or more. During this time, your oxygen concentration will fall. What a lot of people don't know is that the origins begin when we're very young. These are all symptoms of sleep disordered breathing. I know a lot of people will have 1, 2, maybe 5 of these symptoms and not realize how they're connected, but all of them are connected to sleep disordered breathing. Next, I'm going to show you some slides to help train your eye to see what we're looking for. This is Michael. He looks like he could be carrying a little bit of weight, but actually what we're looking at is the underdevelopment of his upper and lower jaws. His upper jaw is underdeveloped to the point that his lower jaw cannot slide into place where it's supposed to be, so it's pushed back. That pushes all of this tissue back and essentially eats up his jawline and makes it look like he has a double chin. These two kiddos here also have underdevelopment of their mid-face and jaws. You can see, always has dark circles that never go away. He is proportionally has a lot of underdevelopment here. You can see how large this part of his face is. This should be equally in proportion, and it is not. Here is a mouth that has underdevelopment of both the upper and lower jaw. The lower jaw is not able to come forward because of the small size of the and narrowing of the upper jaw. So it is pushed back, giving the appearance of buck teeth. You can also see how these teeth are all tilted in, and that is just because when the jaw is not formed like it's supposed to and it's narrow and arching, everything tilts in just like those teeth. This is what we'd like to see. So why are so many children having abnormal growth and development? Dr. Coroncini, who's an anthropologist, was looking into this question. He's studying 400-year-old skulls, and he noticed that they have perfectly developed upper and lower jaws. There's room for all their teeth, there's no crowding, wide open nasal airway, and he wondered, well, why is it that they had such wonderful development? What are we doing or not doing that causes us to have the opposite effect? Dr. Coroncini found pockets of rural indigenous populations that exhibited these exact traits that he found in those skulls. And he wondered, well, why do they have such wonderful jaw development there? What are they doing? It turns out they're breastfeeding for many years, 2 to 4 years, in fact. There's also no refrigeration, so the meats are dried as a preservation technique, leading to a hard food diet. That's what our muscles and bones need to develop properly. They need that really tough resistance of chewing those hard foods and the years of breastfeeding to develop that tongue muscle to be where it's supposed to be, and that's up and forward in the mouth. That's what gives these people the great development that they're achieving, and is certainly what we're lacking in our society of conveniences. We don't have to work that hard, so we don't. And we pay for that with the underdevelopment of our upper and lower jaws, which then impacts our airways. So it's the dietary consistency and the toughness that promote proper bone growth. The soft food diet that we eat currently, and that our babies for sure eat, is what's led to the underdevelopment on such a massive scale that we see today. Dr. Coroncini followed some of those people from the rural indigenous populations, and he just wanted to track to see what happened once they were fully immersed into Western civilization. And it turns out that they became just like us. By the third generation, they had the same rate of malocclusion that we do. But still, there might be the question, well, what if it's genetic? Of course they would have these issues, and maybe they're marrying people from our culture and they're getting it that way. Well, unfortunately, it takes 27,000 years for a genetic mutation to express in 51% of a population. So it only took one generation to have the malocclusion expressed in 51% of the people. So it is definitely not genetic. The problem is here: the inadequate breastfeeding, the bottle feeding, which actually trains the tongue to do the opposite of what we want, where we want it to be. It trains it to be low and back to stop the baby from choking from that fast flow of milk from the bottle. And then the soft diet, which there's no resistance. So those bones just aren't getting the stimulation from the muscles and the work of chewing hard foods. And that's how we wind up here with a V-shaped arch, as opposed to this wonderfully open, lovely arch here. This is a short video of baby Eli having sleep apnea, and then it shows what his mom does to help him.
Okay, this is a picture of Eli holding his breath. Right now he's snoring. We're going to see what happens. This is February 6, 2009. There he goes. He got it. He shakes. He said, "Let open his airway." Just bring his airway forward. Now listen to the quiet breathing.
So this is how we should all sound when we're sleeping. Shouldn't be able to hear us breathing. So his mom brought his lower jaw forward, which essentially opens up his airway. So even at his young age, baby Eli has so much underdevelopment of his upper jaw that his lower jaw cannot be in the proper position. It's pushed back because it just doesn't have the room to be up and forward. So that means that his airway is smaller than it should be. And then add to that his head tilting ever so slightly back. That is enough to occlude his airway. And that's what we see in adults as well, is when you're laying back, especially when you're on your back, the jaw slides back just a little bit farther because it's already pushed back, and it occludes your airway, and that causes the snoring and the apnea. Here we can see the importance of what happens with a properly developed tongue. So this woman on the top, her tongue is in the proper position. It's forward and high, really supporting that arch in her mouth. It has had the strength to help guide in those teeth and do what it was supposed to do, and she's got lovely forward development of her both upper and lower jaws. The bottom picture here shows what happens when the tongue is not strong enough to be in the position where it's supposed to be. It's low and back. This all occludes the airway back here. It's not aiding support for guiding the formation of their upper jaw, and this is what we get. We get a very flat profile with a retruded jaw. And that is the difference that the tongue makes. The tongue is very important, and the tongue is only trained to do what it's supposed to do by those years of breastfeeding. This is a short video that puts some pictures to what we just talked about.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today.
So how can Dr. West help? What can she do for you? Sleep disordered breathing is a medical problem, and as it turns out, there is a dental solution. Most of you have heard of a CPAP machine. That is what we commonly think of as treatment when someone is diagnosed with sleep apnea, and that is indeed what doctors have been prescribing for treatment for over 30 years, and it works very well. The only problem we're finding is that people will stop using it or will not use it or are intolerant to its use, and so they are going untreated. This is where Dr. West can help. Mandibular advancement devices is one of those alternatives. So like the CPAP, it treats the symptom of the sleep disordered breathing by holding open that airway. It works really well at what it does, especially for mild to moderate sleep apnea, and it is easy to travel with and easy to take care of. So it is a great option for a lot of people. Now there's another option for treating your obstructive sleep apnea with oral appliance therapy. This is the Vivos oral appliance, and it goes after the root cause of your obstructive sleep apnea, and that would be the underdevelopment of your upper and lower jaws. This appliance, when worn for 18 to 24 months for 12 to 16 hours a day, effectively stimulates the stem cells in your palatal sutures to start producing bone again. And the effect of that is the development of your upper and lower jaw. The development to such a point, it is hoped, that you wouldn't need treatment of sleep apnea after the treatment period was over. Let's take a look at some examples. This is Hunter, and he was in treatment at this point for about 10 months. You can see here how flat his face is and how far back his jaw is, and he doesn't really have a jawline. Here he's got some really nice forward growth of his face, and he's starting to develop a jawline. Take a look at his teeth. He's got some great results there with this appliance. The really exciting thing about Hunter is that he stopped wetting the bed after 1 week in treatment, and that is because his brain was getting the oxygen that it needed. It didn't need to pull excess oxygen from the bladder. Here's Michael. We looked at him earlier. Here you can see, again, the flat face, the retruded lower jaw, and now we've got a really nice jawline with lots of forward growth in his face. Take a look at his teeth. Here you can clearly see big difference in his teeth, but here, this is what the mouth of a mouth breather looks like, just so you know. Big difference in how his teeth look here when he's using his nose to breathe, because he's opened up his airway by developing that upper and lower jaw. It also has, you know, the cosmetic effect of looking like he had braces, but he did not. This is the most exciting thing about Michael's treatment, is you can see here, before treatment, his airway is very, very small due to everything is just so pushed so far back. There's not room for his airway. Here, post-treatment, you can see he's got an airway that's 3 times the size of the previous airway, and that's just amazing. Let's see some adults that went through treatment with the Vivos appliance. That's pretty amazing, isn't it? It looks like she had some work done. When she did, she grew her jaws and developed her jaws so that it looks just amazing. And you can just imagine what effect that has on her airway. Here you can see what a Gothic arch, person with a Gothic arch looks like in profile. It's, again, everything is pushed back. Her face is flat. Post-treatment, we've got lots of forward growth and a beautiful open arch. And here's another example. It's quite the transformation. And you can just imagine what this has done for her airway. This is without braces. This is just strictly with the Vivos appliance that she wore for about 20 months. And here's our last example of treatment with the Vivos appliance. She was a dentist, or is a dentist, that was suffering from debilitating headaches and excessive daytime sleepiness to the point where she didn't think she was going to be able to continue practicing any longer. She found the Vivos appliance and put herself into treatment as her first patient with it, and she was amazed at the results. It not only changed her gummy smile to one that she was proud of, but most importantly, it got rid of the debilitating symptoms that she was suffering, and she's now able to help others just like herself through treatment with the Vivos appliance. If you think any of these treatments might be one that would help you too, we would love to have you come in and be screened further.